Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined as always by Viv Hudson. Happy Thursday, Viv.
Thanks, Mike, and happy Thursday to you too. So today we have an extra special guest because we have a new product that we haven't talked about before. So you are the master at introduction, so I'll hand over to you.
This one's going to come with a trigger warning too. I'm just going to warn you. This is not to be, you shouldn't listen to this podcast before lunch because we're going to talk about a much needed test, but probably not the most pleasant thing to talk about. But and that is a new GI test that we're offering. And we have on from our laboratory, we have Jamie to explain it. So Jamie, I want to thank you for getting on today.
Thank you. It's nice to be here.
Jamie, can you tell us about your GI test? First off, what is this testing for?
Well, this would be a good test if you go to the doctor with diarrhea, and it's a good way to check for infectious gastroenteritis.
Okay, I know there's been a lot of focus on regulating your gut flora and things like that. So what exactly are they looking for? For certain bacteria, is that what they're looking for, or the presence or lack of certain bacteria?
Yeah, we look for 22 different pathogens. We cover bacteria, parasites, viruses, and the main diarrheagenic E. coli and Shigella that are common in a lot of foodborne illnesses. So this is a good way to see if maybe you got food poisoning, or you can rule that out and maybe look at other non-infectious causes.
And so stool samples have been around for ages. I mean, laboratories have been doing stool samples forever. But how is this test different? Because I understand your collection method is different, I would say, and probably a lot more palatable.
Yeah, well, the nice thing is we only need one small sample. Usually you just dip the swab in a stool sample and send us the little vial, and then you get all these 22 results with one collection.
But it doesn't have to be dipped in the stool sample. I'm going to have to get graphic here, guys. So again, plug your ears if you're grossed out easily. But it can be collected from the patient without a stool sample, right? I mean, it's a swab similar to how you would do a DNA swab or your nasal swab. It's looking at the GI.
Yes, you could do it that way too.
Right, so for some patients that might be a little easier, I'm guessing, because I don't imagine it's actually that easy to collect a stool sample. So I think that's a big plus.
I would think so.
Yeah. So what about insurance? So who's paying for these tests at the moment?
Well, it's covered by Medicare or commercial insurance.
So Jamie, which types of physicians are you getting these orders from? Who's ordering this test? Is this just primary care, or are there other specialties?
Yeah, it's mostly primary care and some urgent cares. Normally whatever doctor would be treating patients with diarrhea. I imagine, maybe some GI specialties would be interested as well to help rule out infectious causes for their patient symptoms. But mostly primary care.
Results, how quickly do they process the results and get the results? Because I imagine you're dealing with like a parasite or something. This isn't a test that you can wait a week for results. Right.
Yeah. As soon as we receive the samples in the morning, and the results are out by the end of the day. So for us, it's about a day's time. It's just, as soon as we can get the sample to our door, we're working on it.
Right. So we're looking at pretty much within 48 hours, doctors should be able to get the results back.
Exactly.
To be able to guide their patients with the best treatment. Okay.
Right.
Go ahead, Viv.
So with the doctors, when you're pitching this test, so you're out in the field as a sales rep, what kind of objections are you seeing from the doctors? Are they quite receptive, or what are their objections?
I think usually, they're concerned about turnaround time because they need to know, they're trying to treat their patient as quickly as possible, but also make sure they're not treating the wrong disease. So turnaround time is definitely important for us.
I'm more curious because the traditional method with the stool sample that is a slower method, isn't it? Or are they able to get quick results off that as well? Is there any advantage to the technology that you guys are implementing in terms of turnaround time?
This is a PCR test, so it's actually testing for the DNA of these pathogens rather than trying to grow it in media. So that, cultures take several days to get results, but we can get this done in a day. So this is definitely a much faster way, and it's more precise. So it's a great way to get to target exactly what you're looking for.
So it sounds like a huge advantage actually then for physicians. So particularly if you're dealing with people with a stomach condition, that they don't want to be sick for days while something cultures. So I think it's a huge advantage for the patient for them to get quite prompt treatment then as well. So I imagine that doctors are jumping on board fairly quickly with this. Would that be the case?
Exactly. Yeah, it's definitely a very it's very helpful. It's nice to have it very quickly. So that's definitely a selling point for our doctors.
Yeah, I imagine, because I know how doctors operate, and a lot of times it's a process of elimination for them. So if you're kind of giving them a shortcut, helping them understand exactly what's wrong with the patients, they could diagnose and get the proper treatment. I mean, we've talked before, Viv, about the overuse of antibiotics and other medications. And I know a lot of times physicians, they'll prescribe medications based on the symptoms, but not maybe having quantifiable data to know exactly what the diagnosis is. And so wanting to treat that patient right away, they may take a stab at something and then titrate the dose and then maybe move it over to a different medication if that doesn't work. But this will give them the proper information that they need to make a proper diagnosis and get the patient the correct treatment as quickly as possible. I think that's the real selling point to this test.
Absolutely.
Okay, Jamie. Well, I want to thank you for getting on. I think we're going to have a lot of interest in this test, and especially as we get now into, we've already spoken to you guys about the respiratory panel, which is offered through the same lab. Seems like it's a very similar protocol. And right now we're getting into flu season. We're getting into the time of year when people spend a lot of time indoors and they transmit germs to one another. And these occurrences happen more frequently. So guys, if you're out there, if you have these call points, anyone who's treating patients for any sort of acute symptoms, this is the time to be hitting those doctors. They're going to be very interested in this test. So, Jamie, I want to thank you for getting on.
Thank you so much.
All right, take care.
Thank you.